Good morning, and thank you everyone for coming. I'm Ian Gallimore from the MBRRACE-UK team in Leicester. I'm really pleased to be able to share our work with you this morning. As many of you will know, it's Baby Loss Awareness Week, which makes today particularly pertinent. When talking about mortality surveillance, it's easy to focus on the numbers, on the rates. But everyone listening today no doubt understands that we aren't just talking about numbers and rates. We're talking about babies who've died and their families. This morning, the MBRRACE team will be sharing the findings of our 8th perinatal mortality surveillance report. This year's report covers the deaths of babies who were born in 2020. So it includes some babies who were born during the first 9 months of the COVID-19 pandemic, including the first national lockdown. And I'll come back to that later on. First of all, I'd just like to say a brief word on what data we report and where it comes from. We collect data on all baby deaths from 20 weeks for live births ending in neonatal death, and from 22 weeks for babies born showing no signs of life. Our mortality surveillance is based on the data provided by healthcare organisations across the UK and Crown dependencies. And I'd just like to express our appreciation for those of you who are watching who are part of that process as reporters for your own organisation. Sharing these data and information on baby deaths is vital if we are to continuously improve the services we provide to keep mothers and babies safe. We then validate this data using death registrations to make sure we have information on all reportable deaths. This data is then combined with birth registrations to provide us with the denominator data, which allows us to calculate our mortality rates. And as you can see, this is not a simple task due to all the different sources of both birth and death data and the large numbers of births every year. For 2020, we're looking at data on just under 690,000 babies. We then bring all of these data together, firstly in the form of a main report, which we'll be talking about today, and then a set of tables and figures which offer expanded data from the report, exploring additional risk factors and outcomes. There's also a technical document detailing our methods, and finally, interactive maps and tables showing mortality rates for different organisations. So today we'll be giving you an overview of the main report. Before I move on to talk about the national rates for 2020, I just want to briefly talk about the great improvements we've seen in how quickly deaths are notified to MBRRACE-UK. In 2017, the percentage of deaths notified within 7 days of the baby's death was only around 30%. And this is significant because delays can be missed opportunities to do things differently in future. However, over the last few years, timeliness of reporting has steadily improved. And in 2020, around 65% of deaths were notified within 7 days, 90% within 30 days. And you can also see that the variation between the 4 UK countries has decreased over time. And this predates the maternity incentive scheme, which requires notification within 7 working days. So this isn't just a result of financial incentives, which is really good news. So let's start with the headline figures for baby deaths in 2020. Out of 689,004 births, there were 2,292 stillbirths and 1,051 neonatal deaths. These figures exclude terminations of pregnancy and are based on births from 24 weeks gestation, so they may differ from figures you see from other organisations. To put this into some context, we can compare the number of deaths with those in 2013. And these figures show a considerable reduction in the number of deaths since 2013. But it's important that we bear in mind the underlying number of births, as this has fallen by almost 93,000 in that 7-year period. So calculating rates is vital to understand how we're progressing. In 2013, the stillbirth rate was 4.2 per 1,000 total births, while the neonatal mortality rate was 1.84 per 1,000 live births. And we can see that there have been improvements over time with continued reductions in rates in 2020. The stillbirth rate has fallen from 4.2 to 3.33 in 2020, which is a reduction of 21%. And for neonatal deaths, there's a reduction of 17%, from 1.84 to 1.53. That means there's been an overall 20% reduction in mortality rates over the duration of the MBRRACE UK programme. And when we look across the individual nations in the UK, the rates for England show very similar patterns to the national rate, because they make up 85% of births. The rates for Scotland, Wales and Northern Ireland are more variable because of the smaller numbers involved. Across the four nations, the stillbirth rate is lowest in England, at 3.29 per 1,000 births. Northern Ireland is at 3.39, slightly higher in Wales at 3.48, and it's highest in Scotland at 3.72 per 1,000 births. For neonatal deaths, the rate is lowest in Scotland at 1.47, and slightly higher at 1.5 in England. It's higher again in Wales at 1.64 and 2.37 per 1,000 live births in Northern Ireland. It's important to note the different legislation regarding termination of pregnancy in Northern Ireland, which leads to higher rates of neonatal deaths associated with congenital anomalies. As I mentioned earlier, this report includes babies who were born during the early months of the COVID-19 pandemic. And care provision during this period was subject to constant, sometimes weekly changes in restrictions, guidance, and staff and resource availability. Data on these changes to care provision is not collected by MBRRACE UK. And the degree of local, regional, and national variation means that it's very difficult to identify a clear and reliable message about the pandemic's impact over the initial 9-month period covered by this report. Now, it wouldn't be unreasonable to expect a potential increase in mortality rates due to things like changes in maternity service access or reluctance to attend hospital. However, if we look at the last 3 quarters of each year from 2016 to 2020, that's the grey shaded area, we can see that rates of extended perinatal mortality and antepartum stillbirth remained fairly stable over the last 3 quarters of 2020, which is the period affected by the pandemic, with the neonatal mortality rate showing a continued decline over the same period. Similarly, despite the effect of the pandemic on provision of services, the intrapartum stillbirth rate showed a continued slow decline over the last 3 quarters of 2020. So the impact of the pandemic is something we anticipate being clearer in the 2021 data, and we'll be including a more detailed explanation in next year's report. Now, let's return to those reductions in national rates and consider what they actually mean. Well, if we apply the rates that were seen back in 2013, we can get a more tangible idea of what these improvements mean in terms of saving babies' lives. So in 2020 alone, this means that there were the equivalent of 820 fewer deaths than if rates had remained the same as in 2013. Over the 7 years since 2013, this equates to over 3,700 fewer deaths. Clearly, the reduction in mortality I presented today is something to be applauded, but we need to do even better if we are to meet the various national ambitions for reduction in perinatal mortality. I'll now hand you over to Lucy Smith, who will be talking about how mortality is affected by gestational age and the combined impact of ethnicity and deprivation. Thank you.